We will continue on the theme of optimizing and reducing the cost of healthcare. However, this time we're going to focus on the efforts required to build a healthcare company in the UK. I would like to introduce our next speaker, James Balmain, the founder and CEO of Zesty. Zesty is the UK's market-leading online healthcare appointment booking system. I will let James tell you more about Zesty, but before that, I would like to tell you more about James. James has over 20 years' experience in internet marketing and retail. He has worked for leading e-commerce and mobile companies like ShopDirect, Very, Littlewoods, and EE. In 1997, James launched Light Image, an internet and e-commerce consultancy which in under 5 years became a multi-million-pound company. In 2007, James launched WebTalks, which is a new online retail operating in the outdoor market. WebTalks grew from an idea to a multi-million-pound company in less than 4 years. Judging by James' impressive track record of growing ideas into multi-million-pound companies, I assume that Zesty should reach the next 100 million in the next 2 months. James, the floor is yours.
So, exactly how hard do I have to press that? There we go. My co-founder's in the audience, needed these slides. If they're rubbish, it's his fault. Very quickly, somebody who was much smarter than me once said that if you want to start a company and you also want to raise money to start a company, one of the great tricks is being able to explain the company in a single sentence. So this slide obviously isn't a single sentence, but what Zesty allows patients to do is book healthcare appointments on the internet in the same way as you can currently book hotel rooms, flights. That was our vision. Access to healthcare is chronically painful as a process when you compare it to booking a hotel room or booking a restaurant. And we wanted to bring that level of consumer-facing simplicity to healthcare. And trust me, it's a lot harder than it sounds. I don't know why this is slided. This is basically our current product. So you effectively, like a lot of other location-based services, you put in where you are, it shows you what services are around you. This is a particularly poor example because actually we don't do an awful lot of NHS sexual health testing, which is what this slide is for. But for example, if you put in dentists in central London or physiotherapists in central London, we have, I think, about 40% coverage of that market in central London now. And we're expanding all over the country as I speak, and it's costing our investors a lot of money. But it's a really interesting business model. We're also in the App Store, and I think I'm not going to stand here and labor the importance of mobile. I mean, I'll do a show of hands. Everybody in the room, put your hand up if you think mobile isn't important. So he just put his hand up. One person. And I don't agree with you, by the way. Mobile is, everybody's using their mobile phone to do absolutely everything. And later on afterwards, I'll find out why you put your hand up. So one of the key things that you need to do if you want to build a business is you need to pay for it. And you hear stories of people who have either raised very small amounts of money and gone on to build very valuable companies or have grown organically. In my experience, they're the exception, not the rule. And if you want to build a marketplace and you want to build it in healthcare and you want to build it in the UK, which is kind of the toughest healthcare market in Western Europe, then one of the things that's absolutely for sure is you're going to need a lot of money. So we've now been through 3 rounds of fundraising, raised just a little bit over $10 million. And it's interesting to note for anybody who's in the venture capital community, who's sat in the audience, that other than for institutional cash, not $1 came from the UK. Now we know pretty much every major London and UK-based VC fund. Don't claim to know them all, but you know all the big ones. And as soon as you go in there and you say, I'm starting a health company, they go, yeah, but we've got this thing called the NHS and it's impossible to work with them and it takes 10 years to do anything, and so therefore we're not going to invest. So actually all of our money's come from everywhere but the UK. Interesting point that we would like to see change. So what we said when we started the company was, A, we're not going to do anything with the NHS. because it's difficult, hard, and they're hard to work with. So we're only going to work on private healthcare. So how big is private healthcare? Well, we can address about 26 billion a year in consumer spend, so that's a pretty big market, so we're okay there. The second thing we said was we're not going to be discount driven, so we're not going to do price comparison, we're not going to allow someone to find the cheapest physio or the cheapest dentist. We're going to be much more about really succinctly servicing an acute need with a friction-free booking process. That was always our idea. And will always be a bookings engine that surfaces live inventory as opposed to just simply a dumb directory listing where the eventual consumer action is to pick the phone up and make a phone call, which actually is kind of what's broken because we call her Gladys, which is very sexist. We'll come up with a male name, but Gladys is the receptionist, and she takes too many phone calls already, and she's only there from 9 till 5, and these are all existing problems that have been brilliantly solved in other verticals, so why can't we solve them in healthcare? We said naively 2 years ago. So, what have we got on here? Anyway, it's an interesting slide that I won't bore you with, but I'm going to try and go forwards. What we found was raising money was that when you talk to VCs who look at, most of the very big funds, they operate what they call a unicorn strategy. And shout at me as an audience if I'm boring you, but a unicorn is a business that goes from nothing to, it's Facebook, it's Google, it's something that goes from nothing to billions of dollars. And if you look at the very big funds, they, 500-600 million or more in terms of their fund size. They need 1 or 2 unicorns per fund to return their fund, in other words, for their fund to make money. So what they'll do is they'll make 50 investments, and their strategy is that 1 or 2 of them will go mega and become very big, very valuable. So the key lesson you learn when you're pitching investors is sell a really massive dream, walk in and go, we're going to disrupt the entire world, we're going to do this, so that's a good top tip. But growth in healthcare is slow, so it's a bit counterintuitive, so you do need investors who have vision, who have patience, and they do exist, but there are not that many of them. Again, one of the other objections we heard was, people don't use the internet for their health. That's actually total rubbish. They do all the time. If you talk to, I don't know if we've got any frontline GPs in the room, but increasingly the GPs we talk to, people are turning up with printouts from the internet saying, I know that I have got cervical cancer. I know I have because I've done this thing and I've been on this website and I've self-diagnosed myself. Turns out they don't have cancer at all. But there's an awful lot of research happening online now. And the bit, as far as we see it, that's missing is there's no kind of aggregation of booking inventory. So if you want to see somebody, it then becomes difficult when it shouldn't be. Working with the NHS takes years. Actually, turns out it doesn't, and I'll talk about that in a minute. Surrounded by red tape and legal issues, this is true, but privacy is an issue that doesn't just plague healthcare. Privacy is a very important issue. What we do with our private information is very important. And I have 2 children, interestingly, who care not about privacy. They're quite young. And I think privacy will be the number 1 issue for the next generation. Just a soapbox moment for you. What mistakes have we made as a company? We didn't charge for a while. Now, think about it. If you're going to build a marketplace has 2 sides. It has supply and it has demand. You can't generate demand without having supply, and you can't generate supply without having demand, so where'd you go? So the obvious thing to do is say, okay, fine, well, we'll build the supply side of our marketplace up first, and we'll give it away for free. And that's exactly what we did. And that was the right strategy for anybody thinking about doing something similar. The problem is we left it free too long, and one of the things we noticed was as soon as we started charging, the supply side of our base, all of our healthcare professionals, suddenly became super engaged with us. When it was free, they saw no value in it. As soon as they had to pay for it, then they saw lots of value in it. And that was a surprising lesson we learned. I'm the tech half of our company, if you like. Although looking at me, you could argue that I'm slightly more than half of it. But the point is, it's a really important strategy if you're going to bring a consumer-facing web or app product to market to do it quickly. You'll learn far more from your consumers using your product than you ever will from sitting around a table talking about it. And there's a big temptation to build a cathedral when actually a house will do. We took that concept slightly a little bit too far in that the first product we released really wasn't very good at all. It did work, and we did learn a lot from it. So I think if we could do it all again, we would definitely invest more than we did in the first iteration of the product. We're very proud of the current iteration of the product, I might add. The other thing as well is if you're going to build a marketplace, make it really wide. We launched in dentistry, and we stayed in dentistry for over a year. And there's this thing called VC time, which if anybody's aware of that, but a year's a really long time if you have VC investors. Like a week is a really long time if you have VC investors. So we stayed in dental for a year. We're now in 7 verticals, 2 countries. The aim is to be in about 20 verticals early next year in about 3 countries, and also to start to power hospitals and all the rest of it. So our business is growing very quickly. But go wide. If you're doing anything that is consumer-facing, one of the things that really gets you traction is giving consumers good, concise choice. And again, we should have done that sooner. And also, yeah, we tried to close big corporate players way too early. And interestingly, they're just beginning to talk to us now, which is a good thing. Recurring theme, there we go. We've kind of talked about this, but one of the issues with healthcare is frequency of use. Again, if you're an investor, what you want is you want a business that has a network effect, you want a business that retains its users, and you want a business that users will use lots and lots and lots of times every week or month or year. One of the challenges with healthcare is people don't use healthcare that often. So how many times do you see a doctor? How many times do you see a dentist? This is one of the reasons we're going wide, because we're now beginning to see cohorts of users who will come onto our platform and say, book a doctor, and then we'll come back and book a dentist, and then we'll come back and book a physiotherapist, so you get your frequency of use up by having that width. But I'll be honest, it's taken us a long time to prove that. And it takes, on the investor side, quite a lot of courage, or we're really good at bullshitting, one or the other, I'm not sure, but probably a bit of both. Bottom left is probably, the right-hand side, you're all intelligent people, you can read yourself, but the bottom left is actually probably one of the more interesting objections that we got when we were raising cash. We were the first people to do this. There were small directory sites that were in one vertical, but we were the first people to come to the market in the UK and say, we're going to do both public and private, and we're going to go multi-vertical, we're going to build this big consumer brand and all this kind of stuff. And because nobody had really come before us, we were almost filling this white space. And you would think, directionally, that this was a really good thing, that we come up with this great idea. You can't argue there isn't a need for healthcare, but actually a lot of investors couldn't quite get themselves to that signing the check bit because there wasn't anything they could compare it to. And our healthcare model in the UK is sufficiently different from everywhere else that they couldn't compare it to what was happening in the States. There were lots of little startups in other sort of Western European countries, but every healthcare system's different. And so sometimes, right now, I'm very happy we were first to market. I think we did the right thing. But it was an interesting objection that I've got to be honest, we didn't really see coming. This is good fun. There we go, good. This is a slide we lifted, sorry it's a bit blurry, we lifted from one of our pitch decks, but there's a really, we talked about digital health, we see it as an ecosystem. And if you go bottom left, research healthcare, I've talked a little bit about that. This is your patient that turns up with reams of printouts from the internet. You've then got the booking platforms where, like us, someone could book. You've then got this concept of a completely portable health record. Maybe it's on a bracelet or it's on my phone or whatever, it's secure and I can be treated anywhere in any country and I want to own my health data. Now, we're not an EMR company, and I'm going to talk a little bit about that in a minute, and we never will be. But I think that top right quadrant, that EMR space, there's some really cool companies in the States playing in that already, and in the UK and Europe, but I think that's really exciting. And then you've got this kind of rating, bringing kind of transparency to healthcare. So let's say I need to have an operation on my knee. I don't, as it happens, but let's say I do. I'd kind of like to know if my knee surgeon is any good. And at the moment, that's quite hard. And then if you delve into outcome data and you say, okay, fine, well, this is really easy. I can go to the NHS, and under the Freedom of Information Act, I can get the outcome data of every single surgeon in the country. And there's something called the Quality Care Commission, and you get it from them. But as you delve into it slightly more deeply, what you learn is that the very best specialists in every area deliberately take on the most difficult and challenging cases. That affects their outcome data. So the more you delve into this, healthcare is complicated, you have to find a way to simply present this data to the consumer. And I think from the outside looking in, I mean, I'm not a healthcare expert at all, but I think that's a big part that's missing in terms of the consumerization of digital health. You're taking very complex, very misunderstood, in some cases, areas, and you have to simplify them and get consumers to the point where they actually, can digest and understand this information in the same way as they would if they were reading a review of a television on Amazon. It might sound basic, but ultimately that's what's required. And then a bit at the bottom with wearables, for us, it completes this loop. And what we hope is we're going to create a virtuous circuit where my wearable device tells me that I need to see somebody, I might do some research, I might then book online, I'm carrying my own health records around with me, I'm using the information, I'm contributing to then rating my healthcare provider, and so the circle completes. And I worked in e-commerce for a long time, as you heard, and used to see a slide that looked a little bit like this that was all around advertising. And one of the sort of things that we were hearing, not so much now, but maybe a year or two ago, was, yeah, but there aren't really that many digital health companies out there, and this ecosystem you talk about doesn't really exist. These are all companies, all digital health companies already that exist. And that is patient reviews top right, digital medical devices, wearable technology, improving your sleep, apps, consumer engagement, big data, EMR. We can make a slide that looked even more Walt Disney's thrown up than that one, actually. I mean, there are tons and tons and tons of companies now coming out trying to solve individual problems, which is, personally, I think brilliant. What I think is not so brilliant is this remote control. There we go. And we have a vision that we want to conquer Europe, yada, yada, yada. So this is just private healthcare. It's 242 billion. If you say that to a VC, they kind of go, that's quite a big market, because it is quite a big market. And next week, fingers crossed, we're going to launch in Holland. We're looking at an acquisition in Germany a bit later on this year. We're very interested in Norway as another market. There's a huge opportunity, we believe, to build an incredibly valuable booking platform and a middleware layer all the way across Western Europe. And there just aren't that many people playing in this space at the moment. How to get started as an entrepreneur. Am I qualified on this? I'm not sure. I think number one, this is the end, by the way, I'm shutting up in a second. The one piece of advice I would give anybody in the audience who is thinking about starting a company is focus. And if you're going to do it in health, it's even more important. The idea that you have when you first sit down may well not be the idea that you end up bringing to market, and it's highly, highly likely that the idea that you end up selling and hopefully making some money out of looks nothing like the idea that you first had 3, 5, 7 years ago. So that's not the point. The focus point is sit down, work out what you're going to deliver, focus on it, and don't get distracted. We're currently selling into hospitals, NHS hospitals, and every single time we pitch a new hospital, they say, love what you're doing with booking, love the idea of a patient portal, I'll have that. We've got this other problem though, and it's kind of technical, and can you do this, can you do that, can you do the other? And we watch a lot of startups that get a bit of traction, then they get totally distracted, and it can kill your company. Focus on what you're good at, stay focused on what you're good at, and don't lose that focus. And I think it's a unifying theme that runs through most of the really successful companies that we've seen, certainly in the digital space anyway, in the last few years. Yeah, hire people that are better than you. That sounds like a really obvious thing. Lots of people don't do it. It's really actually hard to do. If you're a bit rubbish like us, it's quite easy to do, because finding people that are better than you is not that hard. But the concept should be close to your heart. You should always be looking to hire people who are smarter, brighter, faster, better educated, whatever it is, more qualified, more knowledgeable on the subject matter. Always, always, always try and hire the best people you possibly can. 3 is repetition at number 1, 4 is obvious, 5, yeah, good luck with that. We don't, nobody else does. And 6, we'll leave you with that, yeah. So we hear this term that we like, stealth mode. I've got an idea for a startup, but it's like really secret, so I'm not going to tell you. Okay, that's fine. Running a startup, your idea is so red hot, like it's like this super hot idea that if you tell anyone, that to us is crazy. Having the idea is 0.001% of the journey. Executing it and executing it well and bringing it to market and getting somebody else to pay for it, that's much, much harder. So if you've got a great idea, talk to people about it, because the more people you talk to about, the better your idea becomes, I find. Final thought. There are final thoughts. Yeah, back to mobile again. Yeah. Definitely want to find out why you put your hand up. You were like the only one, you know that. Cool. Anyway, that's me. Thanks.